my name's Michelle.
I'm Whitney.
Nice to meet you, Whitney. So I wanted to make certain that you knew that I am a nursing student. I'm working on my doctorate. I think the medical office assistant told you I was going to be doing your assessment. I'm working with the nurse practitioners right now. Perfect. So can you tell me your full name then, Whitney?
Whitney Knoll,
Okay, and the date?
January 26, 2017.
Perfect. And can you also tell me where you're at right now?
Deaconess Hospital.
Okay, so the assessment we're going to be doing today is going to be a full head to toe, so it is going to be some time involved with this. Just wanted to let you know. And then right now, I'm going to ask you some questions just to kind of find out your mental status, make certain that you're understanding everything as we go through the process, okay?
Okay.
So one question I have for you is, what would you do if the house were on fire?
I would call the fire department.
Perfect. Would you stay in the house or would you leave it?
I would leave.
Okay. And then I have a list of numbers I'm going to say to you. As soon as I'm done saying them, I want you to repeat them back, okay?
Okay.
So the first one is 3, 7, 18, 22, 30, and 33.
3, 7, 18, 22,
Perfect.
30, and 33.
Awesome. You did great on those. That can be kind of hard because when you have a bunch of math numbers come at you. And then I'm going to go ahead, I'm going to give you a picture of 5 objects. I want you to look at it, say out loud what they are, and then after I do vital signs and a couple of other things, I'm going to come back and ask you to repeat what those objects are.
Okay.
Okay? So if you could please, just look at these 5 items.
Okay, there are flowers, penguins, a cow, a bus, and a helmet.
Perfect. And like I said, we'll come back to those later, so try and keep those in your mind if you can, okay? And then, while you're thinking about those 5 objects, what's your mother's maiden name?
Montgomery.
Montgomery. Okay, perfect. So what I'm going to do first for vitals is I'm going to check your temperature.
Okay.
And are you familiar with this type of thermometer? It's the one that goes underneath your tongue? Okay, so let's go ahead and do that. I'm just going to hold it there. And you are 98.4, which is normal. And then I'm going to go ahead, I'm going to check your pulse first. So I'm just going to have you rest down. I'm going to do this for 1 minute. Okay, your pulse is actually feeling normal, so I can cut it down to 30 seconds. So when I multiply by 2, your pulse is going to be 72, which is great for a resting pulse rate. Your respirations look like they were about 18, which is also fine. And then go ahead and check your blood pressure. You've not had any work done on your breast, like a mastectomy or anything I need to know about? Okay. Let's go ahead and rest down again. Right, thank you. Blood pressure was 116 over 70, so you're fine with that. Okay. Do you remember the objects that I asked you to remember?
Flowers, penguins, cow, bus, and helmet.
Perfect. All right, so right now I can say that the patient is pleasant, that she's well dressed, she seems to be groomed appropriately. The way that she's been moving herself for me shows decent mobility. She's alert and oriented ×4. Her speech is clear, her judgment's intact, both with recent memory with the numbers as well as remote memory for the objects. She's been able to answer questions that let me know judgment as well, as far as the house on fire, and even can recall her mother's maiden name, and then her vitals were also within normal limits. So next what we're gonna do is I need to check your head and your scalp.
Okay.
No, I'm not looking for lice, and I'm not implying that you've got any of that going on, just wanted to let you know. It's more just to make certain that everything, you don't have any sores that maybe you don't know about, which can happen, especially when you get longer hair, you just don't see them. Okay, so I'm just gonna kind of feel around. And if you have any tenderness at all while I'm doing this, please let me know. You're one of those lucky girls with thick hair, aren't you?
Very
If you want to share some with me, let me know. Okay, so your scalp is round, which is good. You have normal bone structure, like I don't feel that there's anything that's out of whack, to be honest. It's nice and symmetrical. You didn't tell me about any tenderness at all. Your hair is in great shape. If you want to give me tips, that'd be wonderful. Next thing we're going to do is we're going to move on to your eyes.
Okay.
So with the eyes, I'm going to be doing both vision assessment as well as actual structures of the eye. So right now as I'm looking at you, I can tell that your eyes are even, they're in line, you don't have any type of lazy eye or anything like that. Do you wear contacts or glasses at all?
Just classes at night.
Just glasses at night. Okay, so is that kind of, do you have eye strain that you need them more at night? Okay. So, but no contacts ever. Okay, so I don't have to worry about anything with that. So, kind of a hazel color is what I call it.
Mm-hmm.
All right. Say, I didn't know if you'd argue and say, no, they're green or they're brown. Whenever you're looking at me like this, do you have any dry eyes, tenderness when you're just looking?
No.
Okay. All right. How about at night when you have to start putting your glasses on? Do they start to hurt or is it
It's
just
just more of like a blurry.
a blurry? Okay. All right. So now what I'm going to do is I'm going to check the glands in around and make certain that there's not any blockages or anything else that I need to check for. Okay. So first thing, I'm just going to kind of touch across the top. And just make certain if you have any tenderness, let me know. And I'm also going to feel around. Okay. Any tenderness at all while I'm doing that? Okay. And then it looks like your conjunctiva looks like you're moist and pink. There's no like bright red or anything like that. Like you have any upset blood vessels, anything like that. Do you ever use eye drops?
Mm-mm.
No? Okay. And now what I'm going to do is I'm going to check the ducts in your lower eye. So there's going to be some pressure. Pretty much what that lets me know is if there's any type of blockage at all. I'm just going to get pressure. And then pressure. Okay. And then you could open your eyes real wide and look all around. Perfect. So right now I'm saying that your nasal lacrimal duct is not obstructed. That's the lovely little push I just did in here. Like I said, your sclera is white. There's no redness, no irritation. You didn't complain of any tenderness when I did any of that. So it looks like your eyes are in good shape right now.
Good.
All right. So what I would do now is I would also check her for vision if I had that as an option. So what I would do is I would hold a card roughly 14 inches away from her, and I would have her cover up her left eye and read it until she missed. And then I would have the same for the right eye, have her read it until she missed. And then I would have her read with both of her eyes uncovered, and then I would record that score. Next, I'm going to check your pupils, make certain that they react appropriately. Okay. Have you ever had this part done before?
Yes.
Okay. All right, let's make certain we're working. All right. So I'm just going to have you look kind of straight ahead.
Mm-hmm.
I'm just going to shine a light first in one eye and then in the other, and it's just checking pupil reaction, okay? So just hold straight ahead. Okay. Pupils are brisk, equal, responsive, which is good. It means that they shrunk down like they're supposed to. And then as far as, and then they dilate right back up like they're supposed to. So they get small and they get big, just how they're supposed to. So that's perfect. And then I'm going to have you hold your head still for me. I'm going to have you follow my finger with just your eyes. I don't want you to move your head, okay?
Okay.
Start. Mixing things up on here.
I'm ready for that.
Very good, but you did perfect. You tried to guess, but you did great with that. So then that means that your eyes, you were able to follow appropriately all directions. Any tenderness or anything like that when you were doing that?
No.
Okay.